Jumping to conclusions, how to stop anxiety-fueled mental leaps. Jumping to conclusions is a cognitive distortion. Cognitive distortions are what we often call in cognitive behavioral therapy. We all have cognitive distortions. It's a human nature. And so what it is when we jump to conclusions is we believe the worst is going to happen, or that someone else is thinking the worst things, and that we know the thoughts or intentions of others. So as you can imagine, there's a link to anxiety, and the habit often stems from fear or insecurity. And then that leads, of course, to unnecessary stress and worry. The purpose of this video is to provide practical strategies for recognizing when you're jumping to conclusions and ways to break this pattern or habit. So the two most common forms of jumping to conclusions are mind reading. So that's sort of an obvious one, right? So when we think we know somebody else's feelings without them even saying it. So an example is you assume a coworker's quietness is because they're upset with you. And the next one that's really popular is fortune telling. So that's when we think we're predicting negative outcomes of situations when there isn't really evidence to support those fears. And so an example of that is expecting to fail an interview before it even happens. So why is this harmful? It increases anxiety and it becomes a vicious cycle, and we do it automatically. Another reason why it can be harmful is it can damage relationships. If we're constantly misinterpreting somebody else's actions and intentions, that's going to create both distance and tension in relationships. And then lastly, it can impact our decision making and our self-confidence. These assumptions cloud our judgment. They make it difficult for us to have sort of rational, balanced decisions. How to recognize it. So if a friend doesn't text you back immediately, you might assume, oh, they're mad at me, when in reality, they might just be busy. So right there is a good example of trying to catch yourself. And another example might be your boss doesn't provide feedback right away after a project or a presentation. And so you immediately think the worst, you assume they're disappointed, even though they haven't even said anything. So again, these are assumptions that you're going to try to break that it's these automatic thoughts, these automatic habits that we just do. So here's some strategies to stop jumping to conclusions. A big one that I find the most helpful when I'm working with clients is to actively challenge those thoughts. And a way to do that is you can ask yourself, what evidence do I have to support this thought? And you look for the evidence. Often there isn't any. And if there is some, you can challenge that evidence too. How factual is that? How realistic is that? What's the percentage that's actually true? Another strategy is you want to practice mindfulness. So you want to be present. You want to notice when these thoughts are coming up. Another one is using some cognitive behavioral therapy techniques or CBT techniques, keeping a journal, writing down when these thoughts happen, and then again, you can challenge them, you can question their validity. It's practice for you to help rewire your thinking patterns. Lastly, you can communicate directly. If you're really unsure, maybe you've gone through all these steps and you're still unsure about what your friends' intentions were, their actual feelings. And so you simply have open communication with them and just be curious and ask them, I noticed you didn't get back to me yesterday. Just want to make sure everything's okay. That can be an example. So in conclusion, it's breaking this cycle of jumping to conclusions. It will reduce your anxiety. It'll help you maintain healthy relationships. Again, this is such a common habit. I don't know anybody who doesn't do this. Some of us just do it more than others. And so it's possible to break the habit if you practice and there's conscious effort. If you're noticing you're having a hard time breaking this habit and it's something you can't really do on your own, that's when I would recommend seeking out a professional. And Therapy Now SF we have a lot of therapists that this is what we work on. This is a form of anxiety that we're well versed in and can help you out.